Hip dysplasia risk factors.
Our patron, Bruce Foster, used to call it the 4Fs, or Foster's 4Fs. So we've got female, firstborn, family history, and foot first or breech. And then there's other neuromuscular developmental conditions that can predispose a child to have a greater risk of hip dysplasia as well. The last one there is swaddling, which is an environmental condition that we have an impact over. So in terms of the gender, we've got 80% females to 20% males are more likely to have hip dysplasia. But it's not to be said that you should dismiss the risk in boys, because often it's boys who are late diagnosed as a result of being in the minority of children who present with the condition. So firstborn, hip dysplasia is referred to as a packaging condition. So where there's a lack of room in the womb, often a baby will sit in a slightly more compromised position, and it has an impact on the development of the hip, either on one side or bilaterally during their time in utero. Family history is a very strong risk factor for hip dysplasia. The International Hip Dysplasia Institute have done some great research into the increased level of risk of hip dysplasia depending on whether or not there's a family history. And I'll give you a slide on that direct from their website for you to have, because it's great to know. And breech babies. So breech is a very high risk factor for children with hip dysplasia. And again, it's the position of the baby's hip in that position whilst they're in the womb. We don't know as to how long they need to be in the breech position, but we certainly know that babies who sit in the breech position late in the pregnancy, even if they turn prior to birth, have an increased risk of hip dysplasia.